Hi, I'm Shannon Gunderson, a family nurse practitioner at Cupertino Dental and Facial Aesthetics. I'm here today to talk to you a little bit about NeoGraft Hair Transplant and platelet-rich plasma. So here we had patients email us questions that we could answer and post live for you on Facebook. Our first question is, what is NeoGraft? So NeoGraft is a new technology. It's an FUE hair transplant device. So basically what we've got here is the head of the NeoGraft machine. It extracts hairs one by one at the tip of this small hole here. Each graft typically has between 1 and 5 hairs. And then we take those hairs and we manipulate them, count them, make sure that they're viable grafts, and then we place them either in the front of the head or the crown. And then there's always somebody that may have thinning eyebrows. We can place hair grafts there. And then in particular cases, some men will actually have hair grafts placed in their face when they want more hair growth. So that is a little bit about what NeoGraft is. Let me talk to you a little bit about a patient here wants to know what the difference is between FUE and the strip method. So the strip method is the old method. So basically we take a big strip of hair and we cut it out. We cut each of those follicles into grafts and then place those. Those grafts are sometimes a little bit more square shaped, so it's a little bit antiquated technology, whereas our NeoGraft, like I showed you, is a very nice small round graft where it places and grows more naturally. And then as far as scarring, let me give you a little example of what the difference in the scarring is. So the old strip method, here we have a nice big scar across the head. Your FUE NeoGraft device, once the hair grows back in, there's absolutely no scarring. The hair just grows back in a very, very faint amount thinner, which is not noticeable, and there's no scarring. So that would be the difference. Here's an example of a gentleman who has a nice big scar in his eyebrow here, where we were able to place some brow hair and disguise that scar. So that's a little bit about the difference between NeoGraft technology versus the old strip method. Another question we have here is, who is a good candidate for FUE hair transplant with NeoGraft? Most of our candidates that are good candidates are either thinning pretty significantly or actually bald in a section, either the crown or the frontal area. We also do platelet-rich plasma, so sometimes a patient may think they're a candidate for hair transplant, and we can actually regrow their hair with platelet-rich plasma. And that consists of drawing a patient's blood, spinning it down, and taking the platelets and the plasma and injecting it in the area that's just thinning, and we can regrow the hair without even needing a transplant. So that would be another option. The only way to know you're a good candidate for one or the other, or perhaps even both, is by coming in and doing a free consult. We can kind of let you know, guide you through the cost and what you would need. When we do hair transplant, we always soak our grafts in PRP just to make those grafts more viable. They grow healthier. The actual survival rate of the grafts is typically 85 to 95%. So the survival rate of the grafts is very, very good with NeoGraft. So why don't you just give us a call if you think you might be a candidate. Our number here is 408-865-1777. We hope to meet you soon.